So we're just going to keep on bringing the goodness to you. It is my great pleasure to introduce Dr. Amy Ahlfeld. She has a clinical and consulting practice and also serves as a clinical psychologist and resiliency consultant for SSVMS, both of which keep her aware of the challenges medical practitioners face and the importance of personal well-being. Dr. Ahlfeld specializes in providing behavioral interventions and frequently consults with physicians and business executives on how to enhance resiliency and life satisfaction, including facilitating workshops on imposter phenomenon, diversity, team building, conflict management, and performance psychology, all topics which we could all use in spades. Among other things, she focuses on job performance of women and minorities in the workplace, an interest stemming from her dissertation research. She's the immediate past chair of Division I, Clinical and Professional Practice of the California Psychological Association, and a past president of the Sacramento Valley Psychological Association. In her spare time, and I'm surprised she has any, she spends time with family and friends, practices yoga, drinks tea, and enjoys the outdoors. Please welcome Dr. Ahlfeld.
Thank you so much. Really appreciate that, Dr. Chuck. So nice to be here. I think this is my fourth summit, Joy of Medicine Summit. So it's really a pleasure to be here and to be able to present to you all today. And we're in the groove. We already started off with a bang with your gratitude exercises, Dr. Chuck, and then also Dr. Frank's really lovely Ballant groups. And I really appreciate being able to participate. Let's take us to today, 18 months in to a pandemic. And we also know that just a couple of weeks ago, we had a 20-year anniversary of 9/11. And I want to take us back there for a moment and just ask you all to recall exactly where you were on 9/11. Probably, if you're anything like me, you can remember it. You remember where you were, when you saw the towers go down, but you probably remember even more what happened afterwards, the veil of grief that we all were going through. And I remember when the Twin Towers fell on 9/11, I was driving to my first school meeting in South Chicago to discuss placement of my core members. I was a Teach for America program director. It was before I was a psychologist. And I was listening to NPR when I heard what was going on. My husband was in San Diego in between his first and second year of business school and wasn't in Chicago. He had to take an internship there. So he was telling me, as he was watching on television, he was telling me what was happening. Obviously, everybody, the nation, the international community was shocked beyond belief. But more memorable for me was what happened in the weeks afterward. All of the donations and volunteerism that happened, strangers smiling at each other, volunteerism donations at an all-time high pouring into New York City. My 65-year-old mother and father-in-law were Red Cross volunteers and flew from Denver to spend a month in New York City to help people find homes and cope with the crisis intervention that was needed. We as a society were there for each other. We were jolted into looking at things bigger than ourselves, whether we knew it or not. We were suffering and trying to heal all at once. And now, as we faced 18 months into a pandemic, I long for that sense of collectivism and kind of abandoning differences, forgiveness, reconciliation, as I'm sure all of you do too. While I realize how easy it is in my profession as a psychologist, I deal a lot with people who are holding grudges and how people dig their heels in and fix beliefs during stressful times especially. I'm also optimistic because I know that we can do better. And as a psychologist over the last decade, I've also had the privilege of witnessing patients' post-traumatic growth. I've experienced myself and I've had the privilege of witnessing others. And, you know, it doesn't just happen. Post-traumatic growth doesn't just happen. It takes work, it takes time, it takes grace, it takes self-compassion. It necessitates asking for and taking in help, which is so great that we have a community like SSVMS to be able to rely on each other and build that collective help and hope. As for the ongoing trauma of COVID-19, I'm probably like you, kind of a little shocked that we're here 18 months later. When I began working remotely from home back in March of 2020, I definitely had no idea that I would be presenting to you all virtually in 18 months later in September 2021. And also we had no idea that the virus would continue to run rampant and through the country, taking lives, livelihoods, and our sense of normalcy. It's obviously robbed many of connections. Families have been torn apart by loss. Relationships have been strained through ideological differences, varying risk tolerances, and accumulated stress. And, you know, in trauma, you don't have to have lost a loved one to COVID or to the Twin Towers to experience trauma. And I think Dr. Yellow-Lees might be talking a little bit later about some more specifics about trauma, but trauma can just be defined as an emotional response to any event or experience that's deeply distressing us. I apply it loosely, you know, to anything that is something, that makes someone, that is something upsetting, like going through a divorce or cancer treatment or 18 months of a pandemic. And why does this matter? Because trauma, grief, and loss are part of the human condition. And because these experiences inform our thoughts, feelings, and behaviors, which in turn affect our health, as you all know, and our overall happiness and well-being. And it's important that we can address our own internal worlds and to connect the dots between our mental and physical health, and it's necessary to be fully healthy. So in a world with so many challenges, how can we overcome them? Finding meaning after trauma isn't always on the mental menu. Many of us don't have the luxury of moving away from pain or zooming out on suffering. And there's no one size fits all prescription for processing difficult emotions. But the field of positive psychology and happiness research offers some hope and some tools for helping us and our patients move toward post-traumatic growth. One of my favorite musicians is Leonard Cohen, who's no longer with us, but had a legendary career as both a poet and musician. And one of my favorite songs is Anthem. And one of the lines in the song is that there is a crack in everything, and that's how the light gets in. So maybe that's, you know, we thought we were seeing a light at the end of the tunnel by now, but maybe Leonard's line from this song can kind of lead us to the light. And maybe now we're entering this chapter of this pandemic journey, this chapter of our journey with maybe the science of well-being can teach us how to refill our tanks and propel us forward. So first, when we talk about positive psychology, and a lot of you may be familiar with it through SSVMS and other presentations, but let's just highlight a few things. One is that optimism is not a denial of reality. It's about accepting even the most troubling challenges and obstacles with perspectives and intent to not let them stop you from living your best version of your life. Well, I'm sorry. We think that humans are rational creatures, but both neuroscience and social science suggest that we're actually more optimistic than realistic. On average, we expect things to turn out better than they wind up being. People hugely underestimate the chances of their relationships breaking up, they losing their job, or being diagnosed with a disease. They expect their children to be extraordinarily gifted. They envision themselves to achieve more than their peers, and they overestimate their lifespan. But we also know that genes matter a lot to optimism, but that our choices matter even more. prior to 1998, when really the field of positive psychology, spearheaded by Martin Seligman from the University of Pennsylvania, officially took off. If you walk through the bookstores and you saw a lot of literature on the shelves in bookstores, psychology was kind of dominated by self-help books. You know, they were interesting, charismatic writers, but often not a whole lot of substance. And then academic, on the other hand, academic libraries existed. And when you looked at academic journals, you know, most of them are not so accessible to people. You know, again, a lot of us publish in those journals, but you know, for the mainstream people, they are not necessarily reading those academic journals. So when Martin Seligman, the father of positive psychology, kind of helped create a bridge from the ivory tower to Main Street and makes empirically based research on happiness and subjective well-being accessible for people. And how Seligman, and it's funny because there's some green things happening. I don't know what is on the screen, but I'm not sure if that's okay. There's something is drawing on the screen. I'm not sure why, because it's not coming from me, but that's all right. Seligman describes happiness as experiencing frequent positive emotions like joy, excitement, contentment, combined with deeper feelings of meaning and purpose. It implies a positive mindset in the present and an optimistic look towards the future. Importantly, happiness experts have argued that happiness is not stable. One is not always happy. It is not unchangeable, but that it is flexible and that we can work on and ultimately strive towards it. What positive psychology is not, is it's not positive thinking. It's not kitchen sink psychology. Positive psychology is a data-driven science, and many of the data comes up with counterintuitive findings. Positive psychology is not about ignoring negative emotion. Positive psychology is not only for rich white people. There's a grain of truth, however, to the fact that positive psychology was coined at several high-end universities in the United States. And as with virtually all psychological literature, they were tested empirically with college students using samples of undergraduate students at those universities. And since these tend to be predominantly affluent white people, there's some truth to that criticism. But once again, that's true for almost any piece of research in any branch of psychology out there. However, positive psychologists do acknowledge that and continually try to broaden their research perspective, reaching out to international samples and other diverse target groups. And the key, of course, to all of this is to take action. That what we hear about today, the key is to be able to take action, implement, and create habits that lead to systemic change, meaning your systemic change as a person, so that you can increase your happiness. So quick question, and you could put this in the chat. Just a quick survey here. Question: what do you think makes us happy? Us meaning people in the world. What are the key things that make us happy? Be curious if you just take a minute and put something in the chat that you think makes you happy. Genetics, and we heard genetics is part of it, but it's not all of it. Positive relationships, good. Positive relationships, hearing that a lot. And actually, relationships are the #1 key factor to happiness. So, and we'll talk more about that. Having meaning in life, absolutely. Meaning is really important. Feeling valued, nature, sharing experiences, being connected, children and grandchildren, feeling loved, appreciate all of those. What often, if you did this survey to a college group, and I'm gonna go here, sorry. And I don't know, I apologize why there's green lines on you. I don't know if you guys can see that, but I don't know why that is. But anyway, there's a woman that during the start of the pandemic, Dr. Laurie Santos at Yale University teaches a class that is the most popular class at Yale's campus, called The Science of Wellbeing. And she talked in the beginning of her class, and you guys are much more, you're much more wise to this, and maybe it's because of all the good work SSVMS is doing. But what things that most people think will make us happy actually don't make us happy. And the things that people think make us happy are good, having a great job, their position, whatever their career is, money, financial security, stuff like material items, true love, perfect body, good grades or achievements. Those are the things that people think will make them happy. All of those make us temporarily happy when you have them, but they don't have a long-lasting effect. And the things that, with the exception of if you're poor, then obviously poverty does influence whether someone is happy or not. But there's only a certain amount. Like after about 75,000, there's not, per year, there's not really a major change in terms of one's happiness. And actually, there's research that people who make more money are actually less happy after you get to that threshold. The things that actually make us happy, some of the things that you guys said, social connections, relationships, time, kindness, healthy practices, like when we'll talk a little bit later about sleep and exercise and meditation, mind control or meditation, and social connection. And time affluence is another word that Dr. Santos uses, which has to do with not necessarily having a ton of time, but feeling like you have that time is not always back to back to back. So it doesn't mean someone quantifiably has hours and hours, but they have the feeling of affluence of time, a feeling that their time is their own, at least for partially during a day or during a week. And so there are resources and tools that we can, knowing the things that actually make us happy, that we can build on, that we, as medical professionals, can be helpful to you as well. There is another psychologist out of Harvard that also has a happiness class. His class started several years ago. He always jokes that it had 8 people in it and 2 people dropped out. He now has 1,000 people in his class go to his class. And it's the highest rated class at Harvard. He talks about this hamburger model for happiness. And he sees happiness on a continuum. You can see the 2 axes, future, present, future, and then benefit, detriment. And if you start with the tasty, let's go to the quadrant to the bottom right, hedonism. He sees that happiness resides on a continuum and uses this theory to metaphorically represent 4 different kind of archetypes of people who approach life differently. So hedonism is kind of like the tasty junk food burger, the one that tastes really good, but we know is really bad for us. Maybe it's like an In-N-Out burger, is what my son would say. It gives you enjoyment, but then wow, there's going to be problems, in the future, because it's not, very healthy for you. You're not going to feel very well. Hedonists live by the maxim: seek pleasure and avoid pain. Right? Focus on the present, but completely ignore potential repercussions in the future. Type 2 is the rat race, or we'll call it the tasteless healthy burger.
Thank you.
My son would say that's a vegan burger. I hear someone's not muted, so there's, I don't know. Yeah. Okay, thank you. The tasteless healthy burger, my son would say it's a vegan burger. It's a rat race archetype, which is all kinds of healthy ingredients, but doesn't taste, is tasteless. It promises you some future benefit of feeling good and healthy, but it's utterly devoid of any pleasure in the present. It's kind of like an ordeal to eat this kind of burger. Tasteless but healthy represents the rat race archetype. Someone who's a rat racer subordinates the present for the future. And she or he is someone who's constantly on the grinding wheel, suffering now, but for the purpose of some anticipated gain. And then the third one, bottom left, nihilism is the worst hamburger. This type is the worst of both worlds. Tastes horrible, and it's neither healthy nor tasty. And eating such a burger, you would expect present detriment in that it tastes horrible, and then you suffer a future detriment is that it's entirely unhealthy. This is a metaphor for someone who, nihilism archetype, which is someone who's leading a pretty meaningless existence, someone who neither enjoys the moment nor has any sense of future purpose. And then, of course, if we go to the top right, which is the ideal hamburger, which might be the happiness archetype, this hamburger would be a culinary delight, one that tastes great and is also healthy to eat, one that delivers present and future benefits. Such a tasty, healthy burger exemplifies the happiness archetype. A happy person is secure in knowledge that the activities that bring him or her enjoyment in the present will also lead to a fulfilling life. And to a varying degree, we all have parts of these archetypes. Where do you think you fall right now? If you were going to say right now just what I described, you can put it in the chat. What would you say? Where would you fall? Are you closer to the happiness? Are you in the rat race? Are you hedonistic? Are you nihilism? What do you think? I would guess that most of you are between feeling sometimes rat race and sometimes happiness. Yeah. And that's what it looks like. I like Jessica, you said, depends on the hour. I bet that's right. Exactly. So yeah, it depends on the hour. So, so there are factors that are unique to doctors in that when we're talking about happiness and we're talking about these different definitions of happiness, there are factors that are unique to doctors. A recent report just in August that was published by the Physicians Foundation did a physician practice and well-being survey for a year into the pandemic. And it featured some pretty key findings. One is that about 80% of physicians have been significantly, no surprise, have been significantly impacted by the pandemic, with almost 50% reporting reduced income, 32% reporting reduced staff, and 18% switching to primarily telemedicine practice. There's also been a significant increase in reported physician burnout, again, no surprise, during the pandemic, with 61% of physicians reporting having feelings of burnout, which is a 20% increase compared to this burnout level that was surveyed back in 2018. Now, I'm sure a part of that is all of that is probably because of the pandemic. But the pandemic, it's no surprise. The pandemic has had a negative impact on physician mental health, with 57% of survey respondents reporting inappropriate feelings of anger, sadness, or anxiety because of COVID-19. Almost half of physicians report withdrawing or isolating themselves from others, and 34% feeling hopeless or without a purpose. Despite the high level of mental health concerns, only 14% of physicians reported seeking any help, medical attention or mental health help for their burnout. So this is a key time to figure out and to help you all to figure out how you can become happier. And as Dr. Chuck said, I have been privileged to have a unique vantage point because of the work I've done with SSVMS. I've worked with other hospital systems community health systems, facilitating groups, and hearing from physicians on a very regular basis about what they're up against during this time, during COVID and prior to COVID. And there are, trends, all the trends that are here are, that there are happiness challenges for all physicians at this time. And then how can we become happier? How do we see the glass as half full and not half empty during this time when our tanks are running empty? And the good thing is that the positive psychology and happiness research can lead us in the direction of having more satisfactory and happy feelings, in both at home and at work. First, happier doctors have permission to be human. And I like the Valent groups that we were just in the last session, because a lot of that is talking about what your feelings are in response to your patients. And I think there's a lot of tendency in medicine for physicians to have to suppress their feelings, right? Because in order to, logic, ration, having to draw on a whole bunch of data that you know and have at your disposal, and there's not a lot of room always for feelings. But we need to make sure that there is permission to be human and to experience your entire range of emotions. The last thing we want from happiness research is to think that we are, or we always should be always happy. In general, in our society, there's a lack of acceptance of negative emotion, and we think something's wrong sometimes if we feel sad, or we feel anger, or we feel pain or anxiety or depression. The truth is, there are only two kinds of people who don't experience painful emotions: psychopaths and people who are not alive. So so if you're felt any of these emotions, that's good. That means you're not in those two categories, and that's right where you need to be. If you've hung out at all with babies or toddlers, you can see it's completely natural for human beings to experience an entire range of emotions. And it's as adults that we learn to suppress them. And I think sometimes we think, what we need to do is have unconditional acceptance of what we're feeling and what we're experiencing in terms of emotion. Remember that babies and toddlers don't have the brain development to control their behaviors like we do as adults, right? But that just because we are able to control our outbursts or our behaviors doesn't mean that we have to put down or shut down our emotions. I can feel anxious in speaking in front of a group, but I can still do it because I know that it's one of the things that help grow me, right? I can experience envy because a friend or a colleague has had a success that I haven't, but I can choose not to withdraw from them or put him or her down, but instead congratulate them. In fact, there's research that we know that if we suppress our emotion, research by Daniel Wagner proves that the feeling only intensifies. When we let ourselves experience our emotions, we're better able to get over them. And it's important and even more effective to let go of negative emotions when we do that when we're with other people. Again, a benefit of the Valent groups. It's good that we can do it on our own. We feel things on our own and we can let go of it, but it's actually better to do it in person with other people. Even if it's, just 2 to 3 close friends or colleagues that you can do that with, or in a Valent group. So what I'd like to ask you right now, and again, we can use the chat to do that, is what emotion right now are you not allowing yourself to have or feel? And there's a wheel there on the slide that has a whole bunch of different emotions there, in case you need a word. But what emotion right now are you not allowing yourself to have or feel? I see someone said anxiety, anger, helplessness, despair. Yeah. Yeah. And what I'd like to do is just for a moment, as you think about and feel that, if you can just put your hand on your heart, one hand on your heart, maybe your right hand on your heart, your left on your abdomen. And you can close your eyes so you don't have to, or if you're not on the screen, that's fine. Just feel free, just sit comfortably wherever you are in your chair and just experience what it would be like to have unconditional acceptance for that emotion that you've been pushing away. That if you just let yourself, we won't leave you there. You won't keep it all day long, but just pay attention to it just for this few minutes. Just notice, are you feeling calm? Are you feeling anxious? Are you feeling despair, confused, angry? And observe whatever it is and whatever you're experiencing without any kind of judgment. It's okay, it's fine, you're human. And you can just breathe deeply into that emotion as you have your hand on your abdomen and you're just holding your heart. And imagine that when this day is over at the summit, that you'll leave the summit remaining with full acceptance of whatever emotion you're feeling. And this feeling of being able to just accept it, not judge it, just accept it unconditionally. Simply because you're human and it's okay. This is normal. Take just a few deep breaths. And slowly, as you exhale on the last deep breath, you can open your eyes. And just bringing yourself more in the space of you and what you're feeling. I appreciate what you all have been writing in the chat as well. We're going to combine this with, as we're centered, happier doctors simplify their lives, right? That exercise that just took, 2 minutes is about slowing us down. We're going 500 miles per hour, right? And our lives have become ones in which we try to cram more and more into it and have less and less time. So we rarely sit with what we're feeling. We rarely pay attention to what we're feeling because we're so busy. So happier doctors do less, not more. There's a study by Daniel Kahneman that asked women about emotional states while they're doing different things. When they're having lunch with friends, when they're at work, when they're with their children, and found in the range of activities that women were least happy when they were with their children. Now, that does not mean because women don't love their children. This was not because of that. This was because they were holding so much other stuff, the busyness of life, that they, whether it's lists they had to do, correspondence with people, messages, that they were not able to slow down, be present, and just to savor the moment and enjoy their children. We know that one of the reasons that there's increased depression around the world is because of the fact that people feel overwhelmed. There was a survey of over 13,000 college students that found 45% of 18 to 24-year-olds feel so depressed that they cannot function, and that 94% report feeling overwhelmed. We have too much to do. We need to simplify. We have to do less, not more. And part of doing less, not more, is knowing when to say no and knowing how to say no. Because when we say no to things, we are often saying yes to ourselves. Doing less honors your need for recovery. I have some quotes there that you could try on for size the next time you're asked, because you will be asked, and you are asked for a lot of requests. I want to do that, but I'm not available until December. Will you ask me again then? Thank you for asking, but that isn't going to work out for me at this time. Thank you so much for your enthusiasm and support. I'm sorry I'm not able to help you at this time. I really appreciate you asking me, but my time is already committed. Thank you for asking, but I'm not doing any fill in the blank, speaking, teaching, writing, while I'm picking up extra shifts, right? There's ways that we can say no in a way that honors ourselves and is diplomatic with other people. JP Morgan, the financier, was quoted saying, "I can do a year's work in 9 months, but not in 12. It's really, why is it that before cell phones, we used to say that the best ideas come to us in the car and in the bath, right? It's because those are the places where simply doing nothing, right, frees up your creativity, frees up the space to think and to make room to ponder. There's lots of organizational research that points to the fact that we need this in order to thrive, that we need time affluence, that we need simplicity to carve out the space to be able to think, to be able to create, and to be able to not be so overwhelmed. Happier doctors find both meaning and pleasure that find both meaning and pleasure in their lives, ideally in the same activity. So happiness, if you see this diagram, it is found in that intersection between meaning and pleasure in our lives. We cannot sustain happiness only with pleasure, even though right now probably a 2-week vacation or a week-long vacation on a beach sounds great, but that wouldn't sustain us. You wouldn't be happy even if you think you would at this moment in time, I know, but even if you did that for weeks on end, that would not bring you happiness. We would get bored because we need some novelty. And also pleasure is not enough. It doesn't sustain us. There also has to be meaning. At the same time, right? If we cannot sustain happiness only with meaning either. So I care a lot about advocacy and politics on certain issues, and those are important to me, but happiness would not come from me just doing those full time. We need both meaning and pleasure in the workplace and in our relationships in order to sustain happiness. And goals, we create goals a lot, but goals need to be aligned with our personal interests and values. And there are goals that are anchored in meaning and pleasure that are more about goals we want to achieve versus goals we have to achieve. A lot of us have a lot of to-do lists about things we feel like we have to do, not that we want to do. So can you shift from the want tos to the have tos? It's a challenge I'm putting out there for you all. And obviously there are, micro level and macro level goals. I mean, I may enjoy teaching, but not grading, or I might enjoy patient care, but not like the notes and the EHR follow-up, right? So maybe I need to look for kind of happiness boosters, actions I can take to boost my meaning and pleasure, like spending time on the weekend with my family, or joining a board or a nonprofit, or volunteering with SSVMS on the Joy of Medicine board, or engaging in a hobby. Sometimes those happiness boosters have kind of this trickle effect. They trickle effect that they trickle out and give us happiness from those. And they also have a push-pull effect where they push us towards a goal while motivating us to get through the less desirable aspects of life. So how many things, question for you, how many things do you do today that you want to versus you have to? And is there a way for you to shift that? Is there something you can identify, and feel free if you want to put it in the chat or just think about it, whichever. Is there a way to shift a have to a want to? Can you exchange a have to for a want to? And notice for yourself, where does happiness reside for you right now? I'm sorry, I'm not keeping up with, I'm reading as I'm talking, but I'm also seeing your chat. I really appreciate everybody. And I'm hearing that there are a lot of have to's. And that maybe saying no to the ones that obviously the ones that have the most meaning and fulfillment, you wouldn't want to say no to, but maybe using the have to's as a way to kind of look at where are the have to's, and maybe you can say no. Maybe is there any place you can commit right now that you're going to say no to? Maybe one of those have to's you can say no to, leaving this session today. Okay. Happier doctors invest in their relationships. It's the #1 generator of happiness. That was what came up first that you all were writing. These can be intimate partners and soulmates, but they also can be friends or family members as well. There's a married psychologist with the last name of Gottman. Some of you might be familiar with their research. But Gottman at the University of Washington have run something called a love lab for decades, where they have watched couples over 3 decades and watch them in this love lab and not graded, but assess them to note what makes a healthy relationship? How do these people stay together, or what breaks people up? And there's a lot of different research that's come out of that. But what is interesting for our purposes is that they found that success in a long-term relationship these intimate partners have found a 5-to-1 ratio. For every 5 positive experiences, there was 1 negative experience, like conflict of some kind. Which actually allowed in these relationships an opportunity for growth, and also teaches us that conflict immunizes. It immunizes us. If we can overcome or maneuver through the negative experience, we can inoculate ourselves to having deeper, more meaningful connections and more long-lasting with our partners through the ages. So what are examples of those positive things we do to build that 5-to-1 ratio, right? One is showing interest, having a genuine interest in your mate. They talk about love maps with the partners, and it's not just sexual, like love maps, knowing what pleases your partner, sexually, but it's knowing what do they like? Who are they? What are they interested in? What do you know? What do you ask them about? What do you do for them that will bring them great joy? Those kind of things are showing interest, showing a true interest, a genuine interest in them. Second is paying compliments or appreciating them, but verbally, whether that's verbally or writing things down, sending notes or cards, those are really, really important to pay compliments and verbalize that, compliments or appreciations. They also put aside time for love and date night. It would be spontaneous, but we know that in our lives with everyone busy, that if we don't put it on the calendar, it doesn't happen. So that even if it can't be spontaneous, that's okay. But let's make it a ritual, right? If we don't put it down and we don't commit to it, then it won't become a ritual and it won't happen. So putting aside time. And then the last is revealing yourself, exposing your fears, taking risks, being vulnerable, saying what you want, being kindly assertive. It leads to sustained love and affection, because sometimes what people go for is being validated by the other person. That's not what really people want. They want to feel known. They want to feel like their partner gets them, or their friend gets them, or their family member really gets them. That's part of, I think, the magic in therapy when there's a good combination of people, therapy or consultation, is because sometimes people don't have that experience all the time, that they feel like they can be that vulnerable and that someone really understands and gets them. So how amazing, what magic that is. Speak about magic, what magic it is when that happens in a relationship, in an intimate partner or in a friendship. And happier doctors monitor and update their minds and bodies. I could do an entire hour or more. You can do an entire workshop on sleep, meditation, exercise, and touch. I'm just put those down there. I'm not going to talk extensively about them, but we definitely know, it's interesting because for exercise, which tons, and you all know the research that's out there on how important exercise can be, not only for our physical health, but also our mental health. And we know that, in many cases of less severe depression, exercise can basically alleviate it, with mild depression or dysthymia. And then the effect on, cardiovascular health, on strengthening the immune system, cognitive health, et cetera. And often we talk, and I've said this before, I've said, nature's antidepressant is exercise. But in fact, maybe that's not true, because what it shows us too is that exercise gets us to the baseline, right, of our own happiness and satisfaction with life satisfaction. If you take exercise out, we drop our baseline. We drop below the baseline. So maybe it's really like exercising is like taking a depressant, right? And when we do exercise, it just gets us to baseline. So I think that that's important, because our bodies were not made to be sedentary, to sit and look at a computer screen all day, or to sit as much as we are, whether it's in a car or at a chair in an office. So it's really important that, I think our bodies were meant to move, and exercise puts us at a baseline for happiness. And no exercise or very little exercise puts us below that baseline. And I'll say one thing about meditation, or a couple things about meditation. John Kabat-Zinn's done fascinating work with meditation, again, over decades, and the impact on a person, on pain patients, as well as people who are very busy. And because, earlier, and now there's more data. Earlier, they were all subjective measures were used. And so his studies and other studies were criticized around meditation. But later on, they've taken physiological measurements, so fMRIs, after people go through an 8-week meditation program. And this is not a retreat where someone is meditating 8 hours a day. We're talking 45 minutes a day for an 8-week course. And the lefts, they might go to the course one time a week, but then they followed them to meditate 45 minutes a day. And then they did fMRIs, and they found that the left side of the prefrontal cortex changed and became more active than the right side. And we know that the left side of the prefrontal cortex is related to more positive mood states and increased resilience. So thanks to that research that John Kabat-Zinn pioneered, we know that 45 minutes of meditation per day changes the way the brain functions, and that the brain changes until the day we die. And we also know that you don't have to meditate for 45 minutes. You can meditate for there have been changes that have been noticed when you meditate 10 to 15 minutes a day. And it can improve your mood, ability to focus, and your ability to bounce back from stress. So I know, we think of personal hygiene. We take a shower every day. We brush our teeth every day. We'll think of, 10, 15 minutes of meditation per day as your mental hygiene. And there's so many apps. And I know that SSVMS at one point gave Headspace to all the physicians after one of these summits. And so I know that you are all familiar with different apps that are there, but 10, 15 minutes a day. Again, it allows you to stop. It allows you to quiet, it allows you to savor, and it allows you to be at rest without having to think about to-do lists or anything else. And there is so much research out there of the benefit that it truly, in terms of happiness, and beyond happiness benefits, it really makes a big difference. So I want to just, encourage that. And then I'm just making sure, what time do I finish at? I'm just making sure. At 11.
If you could wrap it, if you could wrap it up within a couple of minutes, that'll leave a little room for Q&A.
Okay, great. So then there's some other things here in terms of thinking traps, and a lot of these are self-explanatory. We all know that we can, think we are reading someone's mind. We catastrophize sometimes, or feeling of helplessness. So practice real-time resilience, which is, what's the evidence for this belief or this thought, this thinking trap I have? How can I reframe it? How can I think of something different and plan for that? And then happier doctors have strong PPE habits and strategies. And so there are some, and I don't want to rush through this, but there are some different, some different theories that help us with more expansive emotion. And one of those is Barbara Fredrickson's Build and Broaden Positive Emotion. And so she really has talked about that, understanding positive emotions like joy, contentment, gratitude, love, they broaden our attention. They broaden our awareness and help us be more creative and more cognitively flexible. And that's really important in terms of resiliency, and mental agility is really important of resiliency. Gratitude, I'm not going to talk more about, because I know, Dr. Chuck, you were very great about introducing, and there's a lot of research on gratitude. I'll just say one quick thing about leveraging character strengths, which part of Martin Seligman's work now at the University of Pennsylvania is to create this Center for Positive Psychology. And he created, looking at cultures throughout the whole world, he came up with 24 common character strengths that everybody in the world, have. These people, and some people have, there are some that are, that we lead with, right? Like everybody, there's 24, but there might be the top 4 that you really lead with. And they, through his website, which is like Values in Action, it's viacharacter.org. You can take a test that's online that will ask you all these questions. And then at the end, it will rank your 24 character strengths for which ones are the most that rule you most. And what Dr. Santos from the Science of Wellbeing course said was that she had us take that test, because I did her class. We had us take the test, and then we had to, our top 3 character strengths, we had to every day do something that reflected those character strengths, because what people recognized was sometimes, a character strength, which might be, appreciation of beauty in nature, and then they hadn't been outside for a week, then that you're not going to be very happy. You're not going to be very satisfied. Your well-being is going to go down because that's something that you really value and that's really important to you, but you're not doing it. So it's kind of a useful tool. I can make sure that I share references. There is obviously more to talk about, but I really appreciate being part of the summit today. And I hope there's things that you can take from this, and I'm happy to answer any questions.
Amy, thank you so much. Let's give Amy a big round of applause. So many take-home messages. Thanks for bringing up have-tos, want-tos, happiness boosters, love maps, 5-to-1 ratios, and really good stuff in the chat. Alicia's talked about establishing guardrails. Michael's comment about getting more comfortable doing things like that. Rosalette, saying no doesn't make the have-tos go away, a really important point. And then Terry added the role of intimate partners in this work and setting some guardrails and things. So in the brief time we have, can you maybe address Rosalette's comment about saying no to some things does not make the have-tos go away?
Yeah, saying no does not make the have-tos go away, and that's partly. I think that's partly when we said, what are some of the boosters, some of the happiness boosters. There's things that you don't like that you have to do, right? There's some things, but what you want is you want the scale not tipped so far to that, but that you also balance that with the things that you really want to. And sometimes we get, there's a responsibility that people feel. I know I feel it as a psychologist. I know you feel it as doctors when you're responsible for people's health and well-being, that there's this responsibility taking that happens that then ends up, sometimes leaning towards more of those have-tos without kind of opening yourself up to what do I want, right? And maybe instead of I'm responsible for so much and so many, I have a responsibility to so much and so many. And that shift sometimes helps so that everything doesn't feel burdensome like that. I hope that answered the question.
All right, thank you very much. Once again, big round of applause for Amy. We really appreciate it. That was an action-packed presentation.